Conversion therapy is the pseudoscientific practice of trying to change an individual's sexual orientation from homosexual or bisexual to heterosexual using psychological, physical, or spiritual interventions. There is no reliable evidence that sexual orientation can be changed, and medical institutions warn that conversion therapy practices are ineffective and potentially harmful. Medical, scientific, and government organizations in the United States and the United Kingdom have expressed concern over the validity, efficacy, and ethics of conversion therapy. Various jurisdictions around the world have passed laws against conversion therapy. The American Psychiatric Association opposes psychiatric treatment, based upon the assumption that homosexuality per se is a mental disorder, or based upon the a priori assumption that a patient should change his/her sexual homosexual orientation, and describes attempts to change a person's sexual orientation by practitioners as unethical. The APA also states that the advancement of conversion therapy may cause social harm by disseminating unscientific views about sexual orientation. In 2001, United States Surgeon General David Satcher issued a report stating that there is no valid scientific evidence that sexual orientation can be changed. Techniques used in conversion therapy in the United States and Western Europe have included ice pick lobotomies, chemical castration with hormonal treatment, aversive treatments, such as the application of electric shock to the hands and/or genitals, nausea-inducing drugs, administered simultaneously with the presentation of homoerotic stimuli, and masturbatory reconditioning. More recent clinical techniques used in the United States have been limited to counseling, visualization, social skills training, psychoanalytic therapy, and spiritual interventions such as prayer and group support and pressure. Though there are some reports of aversive treatments through unlicensed practice as late as the early 2000s, the term reparative therapy has been used as a synonym for conversion therapy in general. But it has been argued that, strictly speaking, it refers to a specific kind of therapy associated with the psychologists Elizabeth Moberly and Joseph Nicolosi. The National Association for Research and Therapy of Homosexuality was the main organization advocating for conversion therapy. Fundamentalist Christian groups, and some other organizations, have used religious justification for the therapy. The history of conversion therapy can be divided broadly into three periods. An early Freudian period, a period of mainstream approval of conversion therapy, when the mental health establishment became the primary superintendent of sexuality, and a post-Stonewall period where the mainstream medical profession disavowed conversion therapy. During the earliest parts of psychoanalytic history, analysts granted that homosexuality was non-pathological in certain cases, and the ethical question of whether it ought to be changed was discussed. By the 1920s, analysts assumed that homosexuality was pathological and that attempts to treat it were appropriate, although psychoanalytic opinion about changing homosexuality was largely pessimistic. Those forms of homosexuality that were considered perversions were usually held to be incurable. Analysts' tolerant statements about homosexuality arose from recognition of the difficulty of achieving change. Beginning in the 1930s and continuing for roughly 20 years, major changes occurred in how analysts viewed homosexuality, which involved a shift in the rhetoric of analysts, some of whom felt free to ridicule and abuse their gay patients. Sigmund Freud was a physician and the founder of psychoanalysis. Freud stated that homosexuality could sometimes be removed through hypnotic suggestion, and was influenced by Eugen Steinach, a Viennese endocrinologist who transplanted testicles from straight men into gay men in attempts to change their sexual orientation, stating that his research had thrown a strong light on the organic determinants of homoeroticism. Freud cautioned that Steinach's operations would not necessarily make possible a therapy that could be generally applied, arguing that such transplant procedures would be effective in changing homosexuality in men only in cases in which it was strongly associated with physical characteristics typical of women, and that probably no similar therapy could be applied to lesbianism. Steinach's method was doomed to failure because the immune system rejects transplanted glands, and was eventually exposed as ineffective and often harmful. Freud's main discussion of female homosexuality was the 1920 paper, The Psychogenesis of a Case of Homosexuality in a Woman, which described his analysis of a young woman who had entered therapy because her parents were concerned that she was a lesbian. Her father wanted this condition changed. In Freud's view, the prognose